Okay, so welcome to the 350 Masses Transportation Working Group's webinar on solving the transportation crisis in rural Massachusetts. And we're going to focus on the rapidly expanding microtransit solutions. And our wonderful speaker is Jen Healy. She's the Rural Transit Program Manager for Quaboag Valley Community Development Corporation. Apologize for reading this description, sorry. Which operates the Quaboag Connector transportation service in partnership with the town of Ware. She has a background in policy analysis and program evaluation, particularly in rural areas, and a master's of public affairs from Indiana University Bloomington's O'Neill School of Public and Environmental Affairs, which sounds like a really awesome place. Outside of transportation work, Jen enjoys gardening and birding all around Western Massachusetts. And not to date myself, but every time I think of Bloomington, Indiana, I think of the movie Breaking Away. So
Yes.
Cutter's Rule, yay.
Mhm.
So with that, I will hand it over to Jen. And do I need to make it so you can share your screen?
I think I can share it. Yeah. So I'm gonna go ahead and do that. And if you'll give me a moment to
Let me get rid of that.
just
Okay.
get this going. There we go. Hi everybody. Thank you so much for joining this. It's great to be here with 350 Mass. So as Sarah mentioned, I run a service called the Quaboag Connector. It is headquartered in Ware, Massachusetts. So we're near Belchertown and Palmer, sort of western central Massachusetts. And today, I come to this work through a rural public health lens, and how transportation is a social determinant of health. And part of the reason that we talk about microtransit in rural areas is because, providing what we think of probably as traditional public transit with fixed routes, where you go to a bus stop, there's a predetermined route, and, larger buses, is really difficult to provide in rural areas. And so I'm going to talk a bit about the Quaboag Connector, in depth, and then a little bit about some other microtransit services because there have been a lot of them sort of popping up over the last several years. And I think part of the reason for that is its flexibility. So while I come at this from a rural lens, I think there are lessons to be learned and certainly experience to be taken from this for suburban environments or even some urban environments. So when we think about rural transportation, we mostly think of challenges. And here's just a list of some of the challenges that you can think of, which is that there aren't a lot of people close together. So if you're running a service with a large bus, you're going to have to run it pretty long distances to pick up enough people to make that an effective service. And more than that, we've got country roads that put wear and tear in the vehicles, expensive maintenance, more expensive every year, it seems. And there aren't a lot of like central hubs to bring people to where it would make sense that, you want to take the bus to this particular place. It's more spread out, usually in rural areas. And then there are those are the sort of logistical difficulties of providing what we think of as traditional public transit in rural areas. But there are some other difficulties too. One that we at the Quebec Connector have worked on and continue to work on consistently is public trust and community trust in transit for folks who are not accustomed to having public transit in their communities. It can be kind of a scary thing if you don't know how it works, if you don't trust that it's safe, if you don't trust that it is reliable and will get you where you need to go. That can be a real barrier to using a service. And we find that especially in rural areas. And then lastly, and I'm going to spend quite a bit of this presentation sort of touching on this last one, is that the way we measure transportation is typically ridership and sort of like cost per hour or per mile. Um, that is never going to be a winning situation for a rural area. So if you're only basing it on ridership numbers, it's never going to look like a rural area is worth it to provide transportation. That doesn't mean that people there don't need transportation, right? I think we all can understand that. regardless of how many people might be on the bus, somebody still needs to go to work. They need to go to the doctor. They need to get groceries. And if they don't have a reliable personal vehicle, it can be near impossible to do that. And they have to rely on friends and family, or they just don't go, which is a really big problem. And so, because of all of these challenges, the Quaboag Valley was not served by our major sort of regional transit systems for many years. And so the outcomes of that were we had, 10 years about of community stakeholders coming together and discussing that this was a problem because employers couldn't get employees that could reliably get to work. The local hospitals were having trouble with people missing appointments. People couldn't get healthy groceries. Most, folks that were within, walking distance to a gas station were doing their grocery shopping at a gas station. Not the most nutritious food. And we also have high percentages in the Quaboag Valley of folks that face a lot of transportation barriers anyway. We have a higher percentage than the state of folks over 60. We have a higher percentage than the state of folks with disabilities. These folks are already facing access challenges, and you add on to that the lack of public transportation, and it wasn't a good situation. And so in 2017, well, let me actually pause there before I go into the Quaboag Connector. The reason I think that we've seen so many microtransit initiatives pop up recently is that it sort of provides some um, solutions to some of these challenges that we see in rural areas. And so microtransit can be defined a few different ways. There are a few different definitions sort of floating around, but generally you can think of it as more flexible transit. It is typically instead of a predetermined bus route with stops where riders go to the stop. It typically is demand response or on-demand rides. So the rides come to you, whether it's door to door or curb to curb, rather than fixed route. And sometimes like I said, these can be right to your door. Sometimes the setup is more that, it's a zone where you can be picked up. So, a municipality might say we do pickups, at the library, and folks can if you can get to the library, then it'll take you to your destination. And then you can use it to connect to those larger transportation systems, to those fixed route buses, or you can use it for local travel to complete your full trip, whatever that need is. Often technology assisted. I think most of the services that I'll talk about today have an app where folks can sometimes book their own trips. And they use smaller vehicles, so you don't get as much of that wear and tear on the larger vehicle, and it's just more affordable to run a smaller vehicle rather than a large bus in some of these areas. Um, and I think the flexibility of them is really what I think is worth digging into here because it can be sort of curated to whatever the community needs. And so because of that, it allows these agencies to reach people geographically who maybe can't use, fixed route transportation, but also certain groups of people like seniors, like folks with disabilities that have a harder time using those more traditional transportation services. And so, like I said, I'm going to dive into the Quaboag Connector, but I think, thinking about what your particular community needs are and how a micro transit service might be able to be formed to fit that is the sort of key finding here. Um, so this is the Quaboag Valley for folks that need some, like context about where we're talking about here. The Quaboag Connector serves these 10 towns. As you can see, we're in 3 different counties, and we sit outside of the major lines of 3 different regional transit authorities. So there's some service from the PVTA in Belcher, in like Ware and Palmer. Um, and then there are some bus stops for the Worcester Regional Transit Authority in the Brookfields to the east. But other than that, there really wasn't much of anything at the time that the Quaboag Connector started in 2017. This area is very rural. Like I said, it is older than average, and the population is falling generally. And there are really no big hubs here where there is like a lot of activity that it would make sense for a fixed route bus to go. And it was in 2019, it was categorized as an area of economic distress. So that is like least dense, most rural, poorest kind of designation. And so folks here were really having trouble accessing basic needs due to the lack of transportation. And so in 2017, the town of Ware and the Quaboag Valley Community Development Corporation started the Quaboag Connector. Um, it was then and continues to be a public-private partnership between the town and QVCDC. And it's an appointment-based system. So folks call our dispatchers, they schedule a ride, and our drivers go and pick them up. We're a curb-to-curb service. Um, Here I've included some statistics about our year one ridership, because like I said before, fewer people doesn't mean less of a demand for, needing to go places. It's just that there are fewer people in rural areas, right? So January of 2017, we give 5 rides. And then by December of that same year, it was reliably 700 to 800 rides every month. We have never done any formal advertising. That was all word of mouth. And I think it shows just how badly the community needed a service like this. Um, and so that was how the service looked initially. And since then, it's grown considerably. And it has grown mostly because folks saw this demand and folks finally had this, reliable service that could get them to what they needed most. And other partners wanted to sort of come to the table. So, what we look like now is we have our core service, which is this sort of Quaboag connector description here. That is the service that we started in 2017. It is demand response. Anyone can ride in our 10 towns. Rides are $2 each way. We still do that. Um, but because of the clear need for this transportation service and the way that people were so excited to have something reliable to count on so that they could get to work, get to the hospital, get groceries, we have had several other collaborations sort of come under our umbrella. And so one of those is that we took over all of the transportation for the Ware Senior Center. It just made sense for us to do those trips because we were able to offer the seniors their expanded hours and destinations than they were able to do when just the senior center was running that van. So that started in 2022. That is a donation-based system, so folks don't have to pay, but they can offer something if they want. We started offering free rides to veterans in 2022 as well. This was at the request of the Ware Select Board. Somebody had, the thought to do this, and we were sort of more than happy to roll that out. And then 22 was a big year for us. And then also in 2022, Mary Lane Hospital in Ware closed, which left people who were used to a short drive or even a walk to the hospital facing like a 20-minute drive or like 10 miles to the next closest hospital in Palmer. And so to sort of um, counteract that, Baystate Wing Hospital in Palmer purchased us a van and we signed a contract with them. So we offer free medical rides, non-emergency medical rides, and pharmacy rides to any Baystate facility in our 10 towns. And especially to Baystate Wing Hospital in Palmer. And those are totally free. Anybody going to a Baystate facility for healthcare can ride that van for free, which is maybe our most popular program. Um, and then we also have a collaboration with another of our municipalities, with the Town of Palmer's Community Development Department, through community development block grants. We have a discount for low-income Palmer residents riding for job training, employment, job interviews, that kind of thing. They can ride for $1 instead of 2. And then lastly, we helped pilot with the Pioneer Valley Transit Authority, we helped pilot their B-79 route, which was sort of the first route of its kind. It went from the UMass Amherst campus to Union Station in Worcester, crossing through our service area. And so they provided the vehicle, and our drivers drove that route. And we did that. That was the arrangement for about 4 years until 2025 when it became a full PVTA route. And it is also an extremely popular route because previously there was no public transportation option to get from Amherst to Worcester, and especially not along Route 9, the way that this route goes. So that's sort of what our program looks like now. And that is all due to collaborations. We are mostly grant funded. So these other communities and organizations coming to the table with us is how we are able to sustainably have these additional programs, and to expand the way that we have. Um, and to give you an idea about what our rides look like, this is data from 2022 through 2025. But it looks about the same these days. So about 50% of half our rides go take people to and from work. About 20% are medical rides, and then it's usually grocery shopping and other miscellaneous purposes. The one that I will point out that is 1% for this time period, but has been steadily growing, is this transit connection purpose. This is the code that we use when we are bringing somebody like to an RTA bus stop. So somebody, wants us to take them to Belchertown, to the PVTA stop in Belchertown, so that they can then go further west. Or they want to go to a WRTA stop in East Brookfield so that they can continue on somewhere else. Those have been growing lately, I think, as people need to move outside of the region sometimes. Most of our trips are sort of local, and folks complete the trip that they need to do just with the connector, but that's also something that we watch to make sure that we are working well with the regional transit authorities, and meeting the need as best we can. And then this is what our riders look like. So about 42% of our trips are for folks over 60. About 30% are for folks with disabilities. Just as a note, we have found great success with these two groups of people. I think partially because the software that we use and the fact that we are appointment based allows for some customization. So, because we're appointment based, when somebody books a ride with us, they get sort of a profile in our system. So we can record things like if somebody needs a little extra time to get in and out of their house and into the vehicle, or if somebody feels really anxious about taking public transportation, and needs us to be maybe like a little bit more gentle or a little bit more communicative with them. Of course, if somebody uses a wheelchair or any kind of mobility aid, we have all of that information, and we can customize it to a certain extent. But I think that's part of that sort of personalization is part of what has made our rides really popular with seniors and with folks with disabilities. Just as a note. But then I think what really tells the story of the Quaboag Connector are testimonials from riders. So I won't read these out to you, but this is the kind of feedback that we get really regularly. Folks have come to sort of rely on our service as a lifeline. Folks have rearranged their lives in some cases to make sure that they could use our service. And I think this is where the impact really lies. So from this, I would, of course, say that the Quaboag Connector, this microtransit solution, is a huge success. Um, Folks who are cautionary about microtransit will say, sure, that's great, and it's much more expensive to provide this service. And that makes sense. Per ride, per rider, microtransit, demand response transportation is much more expensive than fixed route transportation. But in this next bit, I want us to think about what metrics we're using when we measure the cost of transportation, and more importantly, the cost of not having transportation, when we think about our communities. So in 2025, the UMass Donahue Institute, which is the sort of research arm of the University of Massachusetts, did an economic impact study on the Quaboag Connector. Um, and they came up with some results that sort of quantified the cost of not having this service in this area that doesn't have many other options. And I'm just going to go through a couple of these. So one thing is you saw about 50% of our rides take people to and from work. The Donahue Institute used their sort of economic software and research about the industry mix in our area, and the fact that there are really not other options for most of these folks to get to work, to come up with the fact that the employment rides that we've done from 2017 to 2024 come out to about $7 million in local wage impacts. And then when you add in the fact that those people getting those wages then use that money in the community, they came up to the total employment impact of being about $31 million over that time period. For many of the folks that we drive to and from work, if it's not us, it's not anyone. They're not going to work that day. Their employment might be in danger. And so that's a huge number. Thinking about that, for me, it's okay. Microtransit is a bit more expensive to provide. What is the cost of not providing it? Of not giving people an option to get to work. Similarly, our next biggest category is medical rides. This is a lot of text. I'll just give you the highlights. There were two findings from this Donahue study on medical rides. The first is about people being able to get to the doctor when they need to go, rather than waiting until it's an emergency and they have to go in an ambulance or not going at all. So the Donahue Institute used a study from 2005 that sort of quantifies the cost of receiving optimal care versus delayed care or no care at all. And they found that over that 8-year period, this is just in cost saved because folks were able to get timely care. We saved folks over $11 million. Um, which is huge. Just being able to get to the doctor on time multiplies into these large economic impacts. The second finding is about cost to providers over missed appointments, which again was one of the initial issues that, helped bring the Quaboag Connector about. And they found that it's about $200 an hour. Of course, that depends on what kind of appointment it is, but about $200 an hour. And so, considering the fact that most of these folks would not have been able to get to their appointments if we were not there to bring them, they found that we've saved them about $370,000 annually, to providers. So those are huge costs. Again, microtransit is more expensive to provide, but the impacts that it can have, in my view, far outweigh the cost of providing it and the cost of not providing it to our communities. And then lastly, I don't know if anyone's noticed recently that owning a car is expensive. I certainly have. This, of course, was a study done in 2025, but they found that the US household on average spends about $12,000 per 15,000 miles driving if you own a car. Um, that's a lot of money. And so there are Quaboag Connector riders that have vehicles that choose to ride with us because paying us, even if they ride every day, paying us, $20 a week to go to work is a lot cheaper than paying for maintenance on their vehicles and putting those miles on them, or than paying for fuel. And so this chart is a breakdown of some of those costs that people face. And so for the 8-year period that this study was done, they found that we had saved folks more than $400,000 in vehicle ownership costs, because they were riding with us. And down the bottom there is a quote about that was given by somebody in the community about the cost of owning a car in the area, and the insurance and all of that. Um, so these are some pretty big impacts. That's just the Quaboag Connector. Um, it works really, really well in the Quaboag Valley. What I think is so exciting about microtransit is that ours is just one form of it. So we have this problem where folks need more public transit options. Microtransit is flexible and can be sort of curated to your community needs. The Quaboag Connector was basically designed by community members in the Quaboag Valley, and there are quirks to it and certain things about it that are, direct feedback from community members. But there are lots of different versions of this. So I have some of these here. Um, all of these are rural, but there's also one that I meant to put on the slide that I did. The Salem Skipper is a form of microtransit in a sort of a more suburban area, of course. The anytime you've seen like a council on aging van, that's a form of microtransit. So they can be, molded to fit the need in your community. So, for example, the Franklin Regional Transit Authority has something called the Access Program. Um, this is their microtransit program. They found during the sort of height of the pandemic that they had these buses, these microtransit buses that were for, ADA paratransit or senior transportation, but they had a lot of empty seats. And so, as folks were sort of returning to using public transit, folks, the general public, they made it so that they could reserve the empty seats on those buses. And that's a great program. They are zone based. So, there are certain places where you can get a sort of door-to-door ride, but there are some places where you have to like go to a town center or something like that and be picked up and then taken to your destination. It's a very popular program and it's run by an RTA. We're seeing more and more RTAs, doing sort of expanded microtransit for the general public lately. Um, there is also in the hill towns, so up um, again in Franklin County, think places like Chesterfield or Ashfield, that area, very rural also. They have the Hilltown CVC Easy Ride program. This is mostly senior transportation right now, but they're looking to expand it. And they blend together some paid drivers with, vehicles that they got through a grant program from the state. And they also have a volunteer driver program where they vet drivers who use their own vehicle and then they get reimbursed for gas mileage as um, their microtransit program. Um, a little bit further west in Great Barrington and six other towns around it is the South County Connector. This is while the Quaboag connector is demand response and appointment based, we require a little bit of like at least a day's notice to do your rides. That's how our program works. The South County Connector is on demand, so it's sort of more like Uber or Lyft in that folks can request a ride within hours of needing it, sometimes even under an hour, I think. And this is a fully municipal program run out of Great Barrington. They were originally called the Tri-Town Connector, and then they expanded so fast that they needed a new name. They do about 3 times the number of rides that we do monthly. We do about 1,000 rides a month. They do about 3,000. And it's a beloved program out in the Berkshires. And then lastly, and the oldest microtransit program that I have here is called Helping Our Women. They're on the Outer Cape. Um, and they've been around for like 30 years. And what they do is they have free medical rides for women to get to the hospital in Hyannis or to Boston for whatever medical need they have. And these are long rides by virtue of where they are in Massachusetts. And they also sort of blend a mixture of a volunteer driver program, vouchers for taxis. They have a real hybrid of a program to make sure that folks can get to where they need to go. And these are just some examples of how microtransit can work. I think, like I've said, the most exciting part of it is that it is flexible and it can sort of meet the needs of your community. I think this is an exciting time in Massachusetts right now for transportation because through The Fair Share Act, we're starting to see more investment in transportation, and we've started to see, slowly more connections in our regional transit system. I'm really excited for a future where we have a more connected state in that regard, and people need to get to the doctor today, right? They need to get to work today. So I think these microtransit systems are a really interesting and important piece in sort of connecting all of us and meeting the immediate need while we hopefully like build to a more connected future. So, with all of that said, if folks are interested in more microtransit, um, there are a few things to know about. One is that last year, I'm going to go out of order here. I'm sorry. Last year, MassDOT rolled out a new grant program that I hope gets funded again, the Microtransit and Last Mile Grant Program. So this is, I think they had $10 million this past year to grant out for microtransit initiatives. Municipalities can apply, nonprofits can apply. Um, if you're sort of filling that need, this grant program is available to you. MassDOT is our largest funder at this time, and they're really the folks that run their sort of grant office for this stuff in the Rail and Transit Division are really, really helpful. Um, on a mostly monthly basis, I facilitate a meeting of folks interested in microtransit or providing microtransit called the Microtransit Learning Collaborative. It is a it's pretty informal. We usually have somebody present on a topic and then there's some discussion, or we have more of a coffee hour set up where folks can bring questions that they have and ask the group and get feedback from the group. We have pretty good attendance. It's a really great group of people just working to try and get things in place so people can access what they need. I'm happy to put anybody on the list for that. You just need to send me an email and I can add you to that. And then lastly, the last thing I'll mention, and Sarah's going to talk a bit about this, is there is a bill in the legislature right now that would have a legislative commission formed to look at microtransit through the lens of its potential to help fill some of these gaps in geography and also to serve some of the demographics that are not necessarily well served by traditional public transportation, and how to fund it. So that is also something to pay attention to. And I am always happy if folks are interested and want to have a conversation. I'm always happy to set up a Zoom meeting. Feel free to send me an email, and I'm happy to set up another discussion. And thank you so much.
That was fantastic. Thank you so much. I realized at the beginning I didn't give you guys a sense of what the night might look like, so I'm just putting the schedule in the chat. So now we're going to turn to some questions, and then we are going to have a little bit of a legislative action at the end of the night. So stick around. I will start with I have so many questions. I'm so fascinated by this. I think I will just start with. I'd love to hear you expand a little bit on the metrics, because it seems to me that in an isolated community like that, the social metrics like the mental health and like the way that it's so community based and all that, they're so much harder to quantify and probably so much less or the legislator is probably less receptive to that kind of less quantified metric. But can
Yeah.
you talk about that metric a little bit, like that?
Like social engagement.
Yeah, I just
Yeah.
I was interested that your particular one allows people to do social calls, like
hmm
go to see their friend or something,
Yeah.
which is
Yes.
great, you know. And if you're older and can't drive or whatever, or
Yeah.
handicapped and can't drive, yeah.
Yeah, I think you are right. It is harder to quantify. There are lots of metrics that we have that are difficult to quantify, which is partially why that UMass Donahue study was done. But in terms of speaking specifically about social engagement, um, one of the biggest public health issues facing, I think everybody, but really rural areas and rural areas with older populations, is social isolation. And that is something that, we work really closely with our councils on aging. Um, that is something that we knew about. And so I don't have quantifiable numbers for that, but I do have story after story after story from folks. Um, about how much it means to them to be able to use the Quaboag connector to do that. Um, Quotes like I think were on that slide, things like I wouldn't be able to get out of the house. Um, or, we have a contingency of people that ride the senior van to lunch on Fridays. And that is their social event of the week. And it's a really important part of the work that we do. Um, and the idea behind the connector is to provide the service and let folks use it for what they need, right? It's not for me to say you can only do work rides. At least this is the way I say it. You can only take this to healthcare. You can only take this to work. It's there was a need and this is what the community wanted, and so this is why we do that. We have one of my favorite parts of it is that I have a whole bunch of rides coded as grocery trips that could also be coded as social engagements because the folks have told us that they, book the trip with their friend so that they can like gossip while they push their shopping carts on Saturdays. Um, I think it's just part of a healthy community and where in rural areas especially isolation is such a problem and coming out of the COVID-19 pandemic, it was such a serious issue. That is something that we really pay attention to. It is hard to quantify in a number. That said, at least in the Quaboag Valley, our representatives in the legislature um, have really been allies and really care about that aspect of the Quaboag Connector too, and they're always happy to hear the testimonials and the sort of anecdotes about our riders. But you're right, it's difficult to put a number on that. But most of the feedback that I get, the sort of glowing testimonials are about like this let me live my life. This let me see people. This let me get out of the house. And the other thing I'll say is that I didn't touch on this a ton, but most of our drivers are retired local seniors that want to stay connected to the community. And so it's also for them, right? And that is a huge way that we were able to build some community trust when we were first starting. Is like folks are going to feel more comfortable if the person driving the van went to your high school. It's they know the community, they know the people there, and the reason that they're doing this is to connect with the community and provide a service to their community. So I think it's a foundational piece of the work that we do. But yeah, it's hard to put a number on it. That's just the truth.
Yeah. Um, but it's real. I mean, it's definitely real
Yeah.
social stuff,
Yeah.
Other questions? Uh,
I
Jane.
think, sorry, I was just going to say, I think Stephen had a question from the chat.
Oh, okay. Sorry, I missed it. But Jane, and then I'll get that one. Thank you.
Okay, what is the time between making an appointment and the time of the pickup? It varies a little bit. And it is varied depending on how at capacity we are. Typically, we ask for 48 hours in advance. That said, if folks call a day before or even same day, we do our best to get them on the schedule where we can. But on paper, we ask for 48 hours notice, just because our rides book up so quickly.
Jane?
Yes, thank you. I'm not going to take a lot of time because I saw Miranda Jennings open up and she actually runs our transportation program. But but as you talk, the things that become interesting to me, and I'm willing to follow up on it later. I'm very curious about how you build out um, a network of partnerships and funding that is reliable because so often, as I've started learning more about this and get it more involved, it's like, oh, funds come in and our transport usual regional planning institutions, whatever, they do something and the funds go away and then they don't do it. So I can't see a person building their rebuilding their lives around
Yeah.
something. So I'm very interested in how the partnerships work and that.
Yeah.
And then the only other thing I'll say, and then I'll stop, is or at least for now, is that I did notice that, Massachusetts, we have that Rural Policy Commission that
Mhm.
started, and they are, I know, in the process of updating their 2019 plan. And one of the chapters is about rural transportation. And I haven't had a chance to dig into it because I only found it a couple days ago. But I'm curious about how whatever they're doing relates to that microtransit legislative initiative that's going on.
Yeah.
Whatever.
Yeah, I'm going to answer the second question first, just because it's a little bit quicker. I am aware, yes, I've met with the Rural Policy Commission in the past, and we have several allies that either are on it or are friends to it and have presented. And I wasn't able to go to the meetings that they recently had about that plan, but we did have somebody submit some feedback to their plan. They did already have microtransit in there. And I think yeah, sort of like trying to present the opportunity that is microtransit to all of these different sort of commissions and state and regional bodies is really, really important. And we try to do that. I try to do that as much as possible for the ones, that apply to the Quaboag Valley or the state. So we do have that happening. And my hope is that those things and the bill that is currently in the legislature feed into each other, because it is sort of all connected, but that sort of remains to be seen, what happens with the bill. But I hope that enough people hearing about how impactful microtransit can be and how helpful it can be to communities will mean that we will see more investment in it, or at least more attention paid to it. As far as the sustainable funding and the collaborations, it's a really difficult time to be funding anything, but transportation, especially right now. Um, we are mostly grant funded. Primarily, we apply for a grant from MassDOT every year called the Community Transit Grant Program. That is the bulk of our funding. The collaborations are actually a big part of the sustainability plan of the Quaboag Connector. And so, what I mean by that is I can get a certain amount of operations and that kind of funding from the state and from some other grants and things like that. And if you're going to provide transportation and something that people build their lives around, there needs to be a certain level of consistency in service. I can't provide rides, for certain hours one year and then slash them the next. People are going to be left out to dry. So part of those collaborations is funding. For example, if all of my funding were to disappear tomorrow, that Bay State medical van would still run because there is funding in that contract. It is its own separate thing. Similarly, um, the senior van that we run for the town of Ware comes with some funding. Those rides are covered mostly by that grant. So the collaborations, while they also expand the community that we serve, and the like hours and the different services we can provide, they also provide some financial stability, because I don't, I never want to cut service, and it's really expensive and really difficult to get funding right now for anything. I'm sure many folks are familiar with that. If you work, with any, providing any kind of service right now, it's really difficult. Um, and because we are appointment based and because we know our ridership so well, if I needed to cut service, I don't want to, and I haven't had to yet, knock on wood. If I had to cut service, I can go to my dispatch and scheduling manager and my operations supervisor, and we can sit down and look at all of our rides and say, how can we cut hours with the least amount of impact to our riders? That's the other piece is, we are able to see where people like, there are 3 times a day that are peak hours for us. It is folks going to work, folks who work a half day going home, and then folks leaving work at 5 or so. Those are sort of the big times the sort of rush for us. So we can look at that and say, okay, like how can we have the least amount of impact on our riders if we were needed to cut a service? But collaborations are really, really important, both because then you reach more people and you can sort of meet the need better, but also because of that sort of financial stability they can provide.
Mm-hmm. Cool. John McDougall.
Thanks so much, Jen. This has been tremendous. I really appreciate your fantastic work over quite a decade now. I have a million questions. I'll confine myself to two. Question number one is, actually a request. Could you send your slides available for maybe folks who couldn't join us tonight but would like to see them? Would that be possible? Maybe send them to Sarah.
Yep, and I think, and also this is being recorded, so it'll be available. Yeah.
Super. Thanks so much. Okay, question number one is a specific thing about Quaboag Connector. I'm not sure if I caught that in the study done by the Donahue Institute, but do you have specific numbers on actual reductions in vehicle miles traveled in private vehicles? That's question number one. Question number two is much broader. Do you have any recommendations for people trying to set up microtransit in more clearly suburban areas, particularly maybe wealthy areas where people do own cars, but of course there may well be large populations like with you of seniors, folks with disabilities. And of course, increasingly we find sort of in the outlying areas connected to gateway cities, there are good numbers of folks who I'm sure could benefit from suburban microtransit. So if you have general recommendations for those kinds of populations, that would be great. Thanks.
Yeah, absolutely. So your first question, so I do not have data on a specific, miles reduced. That one's hard to quantify. We weren't really able to get that. I do know that there are about 1,700 carless households in our area at the time of that study, and that was sort of more, the tricky thing about our area is I think the Quaboag Connector may actually be putting people on the road more because they just didn't have access to transportation
Right.
beforehand. It's tough to figure out exactly how that worked out. So I don't have specific numbers on that. But I do have the anecdotal data of folks saying, I just take the connector to work because why would I pay for the gas mileage when, their fares are only $2. And when the drive to work is, 10 miles and so much of our or more, and so much of our work riders are earning like minimum wage, that adds up really, really quickly for them. So I don't have that specific number for you. To answer your second question, my advice for somebody looking to start something in any area is to do a scan of the transportation resources and potential partners that you have first. So, for example, the Quaboag Connector started by running the Ware Senior Van when it wasn't being run by the Council on Aging. If there are senior centers with a van or if there are, other folks interested in transportation, healthcare providers, people that might be interested in providing this kind of service, I would start there. And I think you can have a lot of success even in these wealthier areas where people have access to vehicles. There's a microtransit initiative in Lexington that folks really, really like. Lex Express, I think is the name of it. Like I said, the Salem Skipper. I think just start with scanning who is interested in doing this and what are the resources that you have. Because in my experience, what I found is that if you can provide something reliable from a transportation standpoint, even if it is we offer rides 1 day a week or we offer rides 3 hours on a couple of days, if it is reliable, and people can count on it, they will use it, and then you will see that demand sort of start to grow. Transportation is one of those things that people build their lives around. So you can just start with the resources that you have, and then with whoever sort of latches onto your service, you can build from there based on the feedback you get from them or from their rides. My first stop would be, is there a community organization that has a van that runs half a day that would be willing to let us run it the other half of the day? Or are there some folks that are willing to drive a few hours a week to offer this service to people? Or is there a destination? Is there, a group that needs to one that we don't provide, but that the senior center in one of the senior centers in our region provides is like a trip to the VA hospital in Leeds, right? Like, is there a destination or a use or a demographic that you can pinpoint that is a good place to start? And then if it's reliable, you will see the demand grow. But then you'll also have some feedback and some data about how it might be most successful and sort of who might be the target group to be using it.
I find it very moving listening to you talk about the kind of patchwork quilt building, community building aspect of like all these different things coming together to form a whole thing. Dr. Saha, next.
Hi. Oh, hi. Yeah, my name is
Like,
Dr. Saha. I'm a physician, and I worked in Boston during COVID. So my question was, what was the kind of role of effective federal legislation in influencing healthcare outcomes, as well as in relating to microtransit? Do you think that
mhm.
that federal legislation has a pretty strong role there? And I'd like to share my own thoughts on that, but I was just kind of
Sure.
curious to hear what you thought.
Yeah, I mean, I think where from my perspective as like the manager of the Quaboag Connector, federal policy has almost immediately meant fewer healthcare resources and fewer healthcare centers and facilities in our region, like just closures everywhere, fewer resources generally. And what that means is that for me is that people need rides and they need rides that are further away, and they need them more frequently because they're losing these resources. So like the closure of a rural hospital in our area was a really big deal. Like sort of anything that is impacting folks, like the loss of healthcare coverage, things like this, it is just squeezing them all the tighter, which means that services like ours are needed even more. That might not answer your question specifically, but that is generally how I, in this role, feel the ripple effects of federal policy is like anything that is being um, rolled back or restricted or the loss of funding means that people are having more difficulties accessing what they need every single day, especially healthcare. And so it's more pressure on services like ours. That's generally how we've felt that.
Interesting.
Yeah, so the reason I was asking is because I'm actually working on a healthcare bill, and I know that right now with the Affordable Care Act and it kind of in jeopardy and things like that. I think that there's definitely a role for federal laws in a lot of healthcare. I mean, in relation, especially to like rural communities and communities that are not as affluent as others. I've published a few books and works on this, and anyone can check it out. But basically, I think that kind of to have these works read is the only way that I can draw wide attention to try and get a healthcare bill like this passed. So I'm happy to share the links if anyone wants to check it out, and feel free to share around. But definitely kind of actively working on trying to move federal legislation in the right direction on a lot of healthcare issues.
Great. Yeah. Thank you.
Jonathan?
Yeah, yeah, thanks. Super interesting questions and information there. I had a question, Jen, about um, what is where can a connector network like yours expand? Where's the potential for expansion and increasing? How would you and possibly even how are you able? How do you foresee that lower cost could be lowered, like through electric vehicles, through these gas miles,
Yeah.
percentage of that kind of thing? But primarily, where's the potential for expansion?
Yeah, so I think when I think about expanding right now, we are actively not doing that because of the uncertain funding situation and because we really are at capacity. And like I said, people build their lives around transportation. I would much rather provide a smaller, reliable service than a larger, unreliable service. Um, but when I've thought about expansion, we could either expand to other towns. And to answer a question that I think was in the chat, I have been looking into how to do that sustainably. Right now, the town of where we are headquartered, and one of the partners obviously puts in quite a few resources and money from their town budget into the connector. We have one other town that contributes financially to the connector, but currently, like, our towns don't pay any kind of dues for this service. It was just sort of like these towns were at the table when the connector started. And that's sort of how that happened. But we've been looking into how we could sustainably ask the towns to contribute financially. Um, while bearing in mind these are tiny towns with small budgets that are already sort of stretched too thin. So we could try to, if we were to find that metric that says, okay, based on population or based on rides or whatever it is, you can join the Quaboag Connector service area for this amount of funds each year. We could expand the service area that way. The other way that we could, and I get requests all the time for towns that sit right outside of our service area, which is difficult. The other way that we could expand is putting more vehicles on the road. Potentially elongating hours. We we do 1,000 rides a month about. If I had unlimited resources, I think I could triple that in like 3 weeks. That's how much demand there is. I think if I had the vehicles to put on the road and the staff to and the funds to run it, pretty easily we could triple the number of rides that we do. And I know that because I once we've never done any formal advertising, but I once did put a survey in the paper, and the number of rides that we did that month nearly doubled. And I thought all of my staff was going to walk off on me because they were so stressed out, among other things, but that's one way that I know. So, yeah, that's sort of when I think about expansion, those are the two directions that I go. But right now, it's not a time to be doing it, unfortunately. Yeah.
Great, thanks.
Miranda.
Miranda?
Hey, thank you. Hi, Jen. Fan club over
Hey.
here. Um, we're out in here in Winchendon, and
Yes.
now Ashfordham. We've expanded to another
Awesome.
another community. Yeah, and I like what you did. Your recipe for success works. I wish it would work like diets would work like that, but what you did was amazing, and we followed kind of your really grassroots community-based model, and it's amazing, and it's yeah, we haven't done any advertising too. It's funny in grants, you put in marketing budgets and then like you don't need them because you don't want to use them because you don't have the capacity. Um
Yeah.
so yeah, that was my question is like and I think so we started out of a senior center, so we're kind of leveraging the MART, which is like the WRTA
Yeah.
contract we had with the town, and then partnering with a nonprofit to use a vehicle, but it's really funded through like the town budget and the MART contract, and now with the Ashburnham Senior Center. But we're essentially doing transit for like the entire community of
Yeah.
Winchendon, and we can't do Ashburnham because we don't have the capacity, we don't have the driver capacity and all that stuff yet. But that was my question, if other towns, and we're also small underfunded towns, like, and it sounds like you're looking into it, but just how could we build like a sustainable model if these WRTAs are already funding senior centered transit that frankly is running very under capacity and like with no software, and there's not meeting the demand at all, and so you hear again and again senior center directors saying, I dedicate half my job to transit, and that's
Mhm.
not like what I'm supposed to be doing. It's
Right. Yeah.
so and I know you just said like you don't necessarily have a model, but I was just gonna ask, like, do you have any MOUs that you use with towns that we could model that off of? And then I just had other like nuts and bolts questions, like, do you as the CDC contract all your drivers, or do you have like the towns contract them? And same with your dispatchers, do you have live dispatch the whole time, or is it like leave a message and someone calls you back?
Cool.
And then what's kind of your staffing structure? And and
Yeah.
I can also set up a meeting with you to talk about this. I
I'm
don't want to take
always happy to meet with folks, but I think that this might be helpful too because I didn't really go into this. So I mean, I think it is for us taking over the Ware senior transportation was kind of a no-brainer because it gave us access to those funds, and we were doing so much senior transportation already that it was
Yeah.
like we're already driving these people, and so it made a lot of sense. And so I think if you're already doing a lot of those rides, especially or rides for that constituency, definitely worth looking into. I will say, I am actively looking into how we can ask the municipalities to contribute. That said, the one other town that contributes financially to the Quaboag Connector, I go to like their town meeting once a year to report on like the rides originating in that town. And I actually just did that this week. And something that their select board says to me it's a small town. It's Munson, Mass, near the Connecticut border. And something that their select board says to me every year is like, this is some of the best money we spend. So I don't know that it's necessarily like an unwillingness to pay in. We just haven't gotten there yet. And it's just the connector evolved so organically, and so quickly that like we just find ourselves here. So I think it's worth looking into, and I'm also happy to set up a meeting. I'm so thrilled to hear about how you all are doing in Winchendon. As for MOUs and structure, I'm happy to share the MOU that we have with the town of Ware, which is our like QVCDC is my employer, but it's our direct partner. Most of that is about sharing grant funds and staffing responsibilities, but I'm still happy to share it. The way that it works is the town employs the drivers and our operations supervisor and handles and owns the vehicles. And all of that. That was easier to do because for things like insurance, the town already has like the DPW vehicles and also gets bulk fuel pricing, which helps a little bit with affordability. And then QBCDC employs me and our dispatch staff. And we started out when the connector first started, it was leave a message and we'll book your ride and get back to you. A request that we had from the community was that they wanted to be able to call somebody during operating hours. So part of the expansion over the last several years was that we do have somebody that you can reach. We have a dispatcher that you can reach the whole time that the vehicles are operating. So that's currently how that breaks down. And then I handle sort of like all programmatic elements and like grant funding and things like this. So that's sort of how that breaks down.
And did you have one dispatcher at a time or two? Because our dispatchers like getting hammered, between
Yeah.
like 9 to 1.
Yeah, we have two during the day, and then starting at 3, we have one, and we have just one on Saturdays. That's
Okay,
just
thank
how
you.
it, yeah, those are all the folks going to the grocery store to gossip. So that's an easier dispatching day for
Great.
folks.
Got it. Cool.
Yeah.
Thank you so much. Those are really helpful
Great.
answers.
I'm glad.
So I have one more question, and then I'm gonna turn to the legislative piece. Do you have a
Okay.
link? You said you do a once a month microtransit learning collaborative. Is there a link to that? Could you?
There's not a link, but if you send me an email asking to be on the listserv, I can do that. And
Can you
then
just put your email in the chat for people?
Yep, I will put my email in the chat and also the Quaboag Connector website.
That's great.
Um,
Thank you. All right, so the next thing we're going to turn to is a legislative action. We're going to streamline the schedule a little bit. So Jen told us that there was a bill which would form a commission to study microtransit, and I know it might seem like a nothing burger, but in fact, that kind of official recognition, Jen told us, is by definition the first step toward being able to ask for line items in the state budget, which sounds much more important than I anticipated. So I've come up with a call script. I've just put it in the chat for people. I'm going to give you a minute or two just to read that, because then you might have questions for Jen about the legislation. So why don't we just take a minute and you can all open that document and read it and then ask Jen questions. Okay. So I know that not all of you are from 350 Mass, so the bit that says, also could you get back to me so that I can tell my 350 Mass node members whether you have co-sponsored the bill. I get that you have other organizations and that's great, but we have found at 350 Mass that putting that pressure on them to get back to you is actually a really good thing. So whatever your organization is. So any questions for Jen on the import of this legislation and why it's important? Or anything about the call script? I know it's getting
What's the
late.
timeline? Sorry, maybe it said in
Yeah,
there.
go
The
ahead.
timeline on like when they would vote on this and
We're really hoping to get it either voted on or attached to another bill like ASAP. Since
oh,
the
okay.
legislative session is winding down, uh, the partners that we work with that have been doing a lot of this advocacy is Transportation for Massachusetts, especially. We've heard a lot of feedback that it sounds like a slam dunk because it doesn't cost the state any money or anything like that, but it's been slow to move for some reason, and so trying to put some pressure on if possible.
Any other questions about it?
Does it have sponsors right now in the legislature?
It does. The lead sponsor is Rep. Farley Bouvier out of the Berkshires and Rep. Smola out of the Quaboag Valley and Ware, and then Senator Comerford as well, and Senator Sear from the Cape have been on the bill. And there are a few others, but those are the lead sponsors off the top of my head.
I'm not surprised about Senator Comerford.
Yeah.
In the region.
Right.
Mhm.
Um, okay, so as we come to an end, I did have one last question for you, Jen. If you had a wish list of 1 to 3 things, what would for the future of microtransit? What would, in the state? What would it be? I mean, I get more funding, but anything else?
Sure. I think what I really want to see, um, for microtransit, but also for Massachusetts transportation generally, uh, my wish list would be a system that is mm, fully sort of interconnected, right? I don't want to be, I would like the Quaboag Connector to not be the only option for people in the Quaboag Valley. Um, I would like to see a like robust bus system and train system that serves the majority of the state. And I would love to see microtransit being the connective tissue of that system so that people can move around. They can move locally, and then they can also access the rest of the Commonwealth via public transportation and accessible and affordable public transportation. So yeah, it would probably be funding, but it would also be infrastructure and things of that nature. I think we are a small state if you think about it, and it is too difficult to move across this state without a car right now. Or even just to move about your lives in this state without a car right now. So my hope would be that we could get to a place where the service from the commuter rail and the MBTA and the RTAs and microtransit initiatives all work together. And folks are aware of what their options are and are able to like have options to meet their needs. That would be my hope, my sort of like someday, hopefully, this is what this will look like.
Yeah.
Yeah.
And Jonathan had one more question in the chat about is there a chart showing which expenses are the biggest in the program?
In our program,
Mm-hmm.
it is staff. Yeah, it is
It's not the
staff.
vehicles, it's the staff.
The vehicles we're able to get through that community transit grant program that I mentioned, you can apply for vehicles from the state, and we've had good luck doing that. So vehicles, while they are big expenses, they're one-time expenses. Of course, the second highest category is probably maintenance and fuel, but it's really it's paying staff to run the service. For us anyway, that's the biggest expense by far.
Interesting. Any last questions for Jen?
I have a kind of a nerdy question that you don't have to answer right now. But tell me, when I was first doing research on the Quaboag Connector, I ran into some comment about that when you were designing this, you use either a process or a group called design thinking?
Yes. Yeah, it's a process. So one of the things that really powered the expansion of the connector over the last several years is that in 2019 we got a large 5-year grant from the Health Foundation of Central Massachusetts. It's called their Synergy Initiative. Part of that, and over that 5 years, they gave us about $2 million or something like that. It was a sizable grant. It's all about sort of scaling projects like ours that deal with social determinants of health, and trying to make them more sustainable and sort of flush them out. Um, the first part of that process, the first year, what we used a design thinking process, which was, and for full transparency, I was not here for a good chunk of this. I started in late 2020. And so, but the process was heavy on community information. So interviews, surveys, focus groups with community members and stakeholders and organizations, to really understand what it was that the community wanted from a transportation service. At this time, the Quaboag Connector had been running like 2 or 3 years, and seeing some success, of course, from that demand, but to really understand what the community wanted. And the things that came out of that, certain hours that they wanted us to run, that bit about wanting to be able to call and talk to a human during all operating hours came out of that process. And so it's all about that process is all about, there are sort of 5 stages of it, but it's all about gathering input, distilling it down, piloting something, looking back, seeing if we met our goals, that kind of thing. And so that was the first year of that grant is what we spent doing that. And it very much informed the design of the connector that we have now.
If that's fascinating, that process. um, Gosh, well, thank you so much. I think your community's so lucky to have you. You not only have like education expertise, but you obviously love your community a lot and really care about the people. So they're so lucky to have you, and we were so lucky to have you tonight. So we really appreciate your coming.
Thanks so much.
Yeah, and we look forward to. I'm definitely going to try to go to some of your collaborative learning things.
Please do. And yes, please feel free to reach out. I'm always happy to talk about this, one-on-one or whatever with folks who are interested.
I think
Thank
we will
you
all
so
be in
much.
touch.
Great.
Yes.
Thank you.
Perfect. Thank you.
Thanks so much.